The Jefferson Curl is one of our most favorite exercises for helping someone learn how to move from each one of their vertebrae without having clunky, stuck, blocky parts in their spine. And what does that mean? Our sitting posture and our daily posture, we start to develop points of tension in our spine, and that tension locks it up in different segments. It's also an exercise where if you don't do it correctly, you could hurt yourself. So it's important that you pay attention to the following instructions on how to keep yourself safe. The important parts of this are the following. You want to remember that the movement starts from the top down and it finishes from the bottom up. Your cervical spine is going to be the first part to move. So at C1 all the way down to C7, you are going to crawl your way down. And then you have 12 thoracic vertebrae. So from T1 to all the way down to T12, you're going to continue to roll. And you have 5 lumbar vertebrae. So from L1 down to L5, you're going to keep on rolling down. And then from that point, you can keep folding forward as long as your hamstrings will let you. So I'm going to demonstrate that now. I'm going to stand nice and neutral, good posture. I'm going to begin from my chin. I'm going to tuck it back, and then I'm going to roll down. I'm getting to my thoracic spine now. I'm really trying to make sure I don't start to get ahead of the position and start to roll somewhere I shouldn't be. I'm going to allow myself to just kind of go limp and hang. This is as far as I get. And then I'm going to begin now from my lumbar spine. So now L5 starts to roll up to L1, T12, all the way up to T1, C7, all the way up to C1. That first little bit of the movement in your cervical spine, I find the best way to get your C1 to move first is to retract your chin back and then start to tuck your chin down, almost like you're trying to create a big double chin. You'll get the sensation that the muscles at the base of your skull, they're starting to stretch, and that means you're starting to move from there. For me at this moment, my low back's really tight, did a lot of activity today so far. So once I got down to a certain part in this movement, especially as if I jump forward, I got to about here, I can feel that my body wants to just skip here, and I just kind of want to start going forward, but I'm really fighting it. I'm trying to check in with the movement, trying to check in with what I'm feeling, and I'm really trying to insist that I keep the order of succession of vertebrae as I come down, and then also as I come up. My body wants to skip my lumbar spine and just move from my thoracic, but I'm going to force it gently encourage and kind of will it to move from the lumbar spine first, then my thoracic, and then my cervical. You can perform about 5 to 10 reps of these. Only add weight if you are truly an all-star at this movement. The point of it is not to get really strong with weight. It's to use the weight to challenge your ability to do the movement.